Have you ever had a thought that made you feel so scared that you had to do things over and over to make yourself feel better?
Intrusive thoughts.
The person with OCD is aware that it's irrational.
A 20% chance we might crash.
Have OCD and hide it.
They feel very bad about it. They feel very scared.
The obsession can change.
My hands get dirty and I look down. The way I will feel.
Anxiety and OCD.
Thought comes in, it makes them feel scared, and then it makes them do something.
Welcome to Session and Secrets. And today we have a very interesting topic, something that is often misrepresented, minimized, and misunderstood. OCD, or obsessive compulsive disorder. And I'm here with my guest, Amy Herter, an expert in this topic. Tell me about yourself, Amy.
So I'm a licensed marriage family therapist. I have a private practice in Yorba Linda. I've been in practice since 1999. I've been licensed since 2002. And the majority of my clients have OCD. I see clients of all ages, families, couples, and most of my work is focused on OCD.
So what is OCD?
So OCD involves obsessions and compulsions. You can be diagnosed with OCD if you just have one, but most people with OCD have obsessions and compulsions. Obsessions are intrusive thoughts, images, urges that come in and cause you anxiety and disturbance. Compulsions are checking, they can be behaviors. Compulsions can be mental or physical. So for example, someone might have an intrusive thought that comes in that would be an obsession about that their stove could be left on and it could burn their house down. And they could have images of their house burning down and everybody getting hurt, and they can feel really scared about that. And so it could cause them to have compulsions, which would be to check their stove many times. They also might have mental compulsions where they think about, did I check? What was I doing? Did I actually touch the stove? And go back over details. They might have compulsions that involve reassurance seeking, and they might text. If they're out, they might text their spouse or somebody and say, "Are you sure I turned the stove off? I think I did, but do you think I did?" So those would be examples of compulsions.
What are the most common misconceptions?
So a big misconception with OCD is that it's productive or that's perfectionism, which OCD is not perfectionism. So somebody with OCD, the things that they're doing, they really, really dislike what they're doing, and it's not exactly productive. So they get stuck in those things. I think there's this concept that someone with OCD has a perfect kitchen and everything's all the labels are facing and everything's perfect. That's more OCPD, which is obsessive compulsive personality disorder, not obsessive compulsive disorder. So in obsessive compulsive disorder, the person has a lot of anxiety and the things they're doing are driven by anxiety, where obsessive compulsive personality disorder, they're doing it in more of a perfectionist way, and it's more just that's the way it should be. So if you meet somebody with OCD and you ask them, do you like what you're doing? They'll say they hate doing what they're doing. They don't like it. It's not the way, if you catch them when they're calm, they'll say they don't like it. They don't feel like it should be this way. It doesn't make a lot of sense. It's not a perfectionistic thing where if you talk to somebody who has perfectionism, they'll say, oh, of course it should be done this way. The world would be wonderful if everybody did everything this way. And so it's very different than that. It's not perfectionism.
So it's like the person with OCD is aware that it's irrational, right? That it's
correct, depending on when you catch them. So if you catch them at the height of their anxiety, in that moment, they are not going to be aware, and they're going to be stuck in a loop of feeling like they have to do it because their anxiety is so high. When somebody has high anxiety, they have physical symptoms of anxiety. So they feel your body's in fight or flight. You feel like something really bad is going to happen, and you can't really process information properly. And the reason for that is because anxiety is protective. So normally, if somebody has anxiety and it's not, an overreaction, you'll have a fight or flight, and it will help you. If there's a fire in here, if I sit here and think about which way did it come in, what's the best thing to do, I'm going to die. But if I just take off and run. I'm going to be safe. So that's the state of mind someone is in with OCD. They're in that state of mind. They're not in a reflective state of mind. When they're calmer and having less anxiety, they can say, oh, I don't know why I do these things. I can't stand these things. I wish that I didn't have to do them. So I'm not sure if that fully answered your question. But
Yeah, that gives me a better understanding.
Yeah.
So what about at what age do symptoms usually begin?
So symptoms can begin at any age. People can have OCD start at any age. A lot of times people with OCD have a family history, but not always. And it can happen really at any age. It's a little unusual to happen after the age of 35, but anybody at any age can have OCD develop. And, one thing to be careful about, though, sometimes people have a toddler and they'll think their toddler has OCD, but toddlers typically have OCD-like behavior. It's developmentally normal for a toddler to like things over and over the same way, for them to have interests that are very narrow. A toddler will be talking about dinosaurs all day, and that's all they want to talk about. Or they want the same routine at night. They want to brush their teeth, wash their face. They watch this, read this book. They want everything exactly the same. And if it deviates, they do get anxious. And so that's not OCD. So in a toddler or young school age child to diagnose OCD, you really want to make sure that their symptoms are excessive and that there's a family history. It isn't impossible for a small child to have OCD. It's just you have to be careful about the diagnosis at that age.
Okay. Yeah. How does OCD affect a person's day-to-day life?
So OCD really impacts someone's day-to-day life. And just to kind of give you an example of what OCD feels like, say you and I get on a plane and the plane takes off. We're in the plane, we're seatbelted in, we're in the air, and the pilot he comes on the loudspeaker, he or she, and says, well, some good news and some bad news. The good news is we're going to be on time. The bad news is we had some mechanical issues, and we kind of fixed them, but, there were some we couldn't fix. We really want to be there on time. There's probably a 20% chance we might crash. There's an 80% chance we won't. How would you feel if that happened?
Yeah, panic.
I would too.
Panic mode.
Exactly. What would you do if you were on a plane and that happened? Can you imagine what you would start doing?
Cry.
Yeah. I would start, asking the person next to me, like, did you hear that right? I don't know if I heard that right. Did you hear that right? I might be asking other passengers, like, has this ever happened to you? Do you think we're safe? I would be asking the flight attendants.
Definitely not safe.
Exactly.
For sure.
Yes, exactly. And that feeling that you can picture, that's how someone feels with OCD when their anxiety is high. They feel like these thoughts that come in, these images that come in, they feel like they're very dangerous. So there's kind of a misprediction of the danger of something. They're over feeling like it's more dangerous than it is. And everybody has intrusive thoughts as well. Even people without OCD. Mm-hmm. So I'm sure, normally you can notice them more when you're over like in an anxiety-provoking situation, but everybody has them. I don't know if you've noticed yourself having intrusive thoughts before.
For sure. Throughout the day.
Exactly. And, so if someone doesn't have OCD, they have an intrusive thought come in and they go, that's weird. Like if I'm sitting here and I have an image of like pushing the microphone over, I'd be like, that's weird. But if I had OCD and I had an image of pushing the microphone over, I'd go, why is it there? What does that mean? Does that mean I'm going to do that? And then I might do something to keep myself safe, like put my hands here or move backwards or start thinking about like, when was I in front of a microphone before? What did I do? What's going to happen? If we had a break, I might text somebody and say, why do you think I thought that? Do you think it's going to happen? So that would be kind of the difference to show you like what intrusive thoughts look like for somebody who has OCD versus who doesn't. Because everybody could have that same intrusive thought. It doesn't necessarily mean you have OCD if you have the intrusive thought. You get kind of stuck in it and you feel really panicked and you feel like it's likely to happen and you need to do things in order to make sure it doesn't happen.
Okay. So can someone have OCD and hide it well?
They could. I mean, there's certain types of OCD that people really feel tormented by. So OCD can have any theme. I know if you look online, it will talk about different themes, which could be helpful because it does let people know that there are many kinds of OCD people can have. It's not just about germs or hand washing, which some people have that misconception, but really it can have any theme. So it's, there's not really categories of OCD themes that are true as far as if you went to a clinical training for OCD, they would say, people's OCD can look different. Anybody can have any sort of fears. It doesn't have to be these specific categories, if that makes sense. But if some people have intrusive thoughts about things that are like harming themselves, harming someone else, harming their animal, harming their child. And when someone has that, they feel very bad about it. They feel very scared, and they do tend to kind of hide it. And not always, but because it's scary, and they feel like, why are these thoughts coming in? Does this mean something? Is it dangerous? Are these things going to happen? It makes them really scared to have them. And those people are not dangerous. They are afraid. If you had your worst fear come to mind, that doesn't mean that you're going to do your worst fear. It means you're scared to death about that worst fear.
Yes. And that worst fear can look differently, right?
Yes.
It could be fear of getting sick, or fear of any fear that becomes more, that we perseverate in it.
Yes. It could be anything. And the thing is, too, sometimes therapists or people will get stuck in that, well, what's the fear? And really with OCD, not only is it the person's worst fear, but it can change a lot. I might see somebody who has OCD and they'll say, I know it's OCD again because before I was so afraid of germs. Everything I did was washing, and I was totally terrified of germs. Now I don't care about germs. I can lick my hand and I could care less. But now I keep thinking I ran somebody over, and I keep having to drive back and check and drive back and check. So if you get too wrapped up in what the person's fear is, then you're kind of missing the OCD, because it's really OCD that needs to be treated, or just the fact that someone is getting stuck in an obsession and has a compulsion is the underlying issue, if that makes sense.
Yes. So then, just to clarify, so the obsession can change, right? It can change.
It can change
over time.
It can change over time. Some people have more than one theme. Typically, people get stuck in a theme. For most people, it doesn't flip around in, say, 10 minutes. For most people, they get stuck in one theme at a time. It's not impossible for it to flip around, but it's obsessive because it's kind of a stuckness in this fear or intrusive thought than having a compulsion to neutralize it and feel better.
How does shame have a role in the symptoms of OCD?
So shame has a role in the symptoms of OCD, especially if somebody has OCD intrusive thoughts that make them feel like a bad person, or if they're against their religious beliefs, if they're violent. In that way, somebody can feel shameful about it and feel like they're responsible for their thoughts. So there's kind of an over sense of responsibility, because as we talked about before, everybody has intrusive thoughts. So they can be anything. Sometimes people notice having an intrusive thought about driving off if there's driving off the road. And if they don't have OCD, they'll be like, oh, that's weird. Why is that there? But with OCD, so everyone has them. So if you feel bad about something that's an experience everybody has, that's pretty awful for you, if that makes sense.
Yes. And so I have some comments from you, for you. So if the soap, and I want to pick your brain.
Okay.
If the soap I'm using falls onto the shower floor, I will scrape the layer that touched it completely off, because the soap is dirty in my mind.
So with OCD, it's possible. It's hard to tell if somebody has OCD because some people just like to be clean and neat. There are people, I'm sure you've met people in your life who don't have OCD, but they like things to be clean and neat. They worry about germs a lot. So I tell my clients I tell them my clients with germ OCD, who have mostly germ themed OCD, if somebody was concerned about germs and they went camping. So say I don't like germs, I'm really clean, and I go camping. And then my hands get dirty and I look down. The way I will feel is kind of just like a little bit of disgust. Like if I ate something I didn't like, ugh, but I won't feel like my hair is on fire. If somebody has OCD and they're in that situation, they will feel like their hair is on fire. They will feel complete panic if they see that. And so that's how you kind of know the difference between someone who just is kind of clean and doesn't really like germs versus somebody who has OCD. So it's about the feeling and the level of anxiety somebody has, as well as how many compulsions they're doing, if they're doing a lot of compulsions, and it's taking up their time, taking away from things in their life, then it definitely, would look more like OCD versus if it's just somebody who's being clean. Yeah, because they are particular.
Okay. The next one is whenever I've already washed my body and accidentally bump into the walls, I must wash that part again.
Yeah. I mean, again, it's the same kind of thing where, it depends. Is someone doing this multiple times? Are they getting stuck in a loop? Is somebody, washing over and over is definitely a part of germ-themed OCD. Mm-hmm. Many clients who have that experience chapped hands, sometimes bleeding on their hands, rashes from the level of washing that they do. They spend sometimes hours washing either in the shower or in front of a sink, or they're repetitively doing that in order to feel safe and calm. And so with OCD, if someone does have OCD, if it's taking up a lot of their time and energy and interfering with them being able to do the things they want to do in life.
Right. Okay. I have another one.
Mm-hmm.
When I was younger, I would put my hands in my pockets to make sure that I still have my trousers on. Despite seeing and feeling them, I must check by putting my hands in my pockets.
Yeah, I mean, the must check part sounds like a lot like OCD, because when people have OCD, they feel like they need to know something 100%. They have to have 100% certainty. There's no room for, well, I'm kind of sure. It has to be 100%. Kids, you have to be kind of tricky a little with diagnosing kids with OCD, because kids have a lot of magical thinking. And so you want to make sure, is this developmentally appropriate? Is it getting in the way? Is this just something that a child has right now as a fear or worry, and it's not impacting their life? If they're continuously having to put their hands in their pockets over and over and over, and it's interfering and they feel panicked if they don't do it, then that would be more of an OCD sort of symptom. And it kind of depends on their age too. Yeah.
Okay.
Mm-hmm.
And the next one, recreating facial expressions in the mirror based on memory to see if I did a bad or a rude one.
Yeah. Again, that definitely could be a compulsion. There are other types of anxiety as well, though. There's social anxiety too. Mm-hmm. And so in social anxiety, people feel anxiety in social situations, and sometimes they will think about the social situation. Right. And so you would want to know is what kind of is going on in their mind if they feel panic level, which would be in both cases, they would have that. Mm-hmm. And if they're doing it in a compulsive manner, and what's kind of going on.
So over and over?
Yes, over and over. Mm-hmm, definitely.
Okay. And do you have any other ways of differentiating what is just anxiety and OCD?
Yes. So OCD, definitely somebody has compulsive behaviors or compulsive actions or compulsive thoughts that they do in response to their obsession or intrusive thought or fear. So it looks a little different. If somebody has, say, generalized anxiety, they might have a lot of fears and worries about, am I going to get fired? Am I going to be able to pay this bill? Am I a good parent? With generalized anxiety, it jumps all over the place and there's a whole bunch of fears. But with OCD, it's more specific, and the person experiences it as a thought coming in. So it's more intrusive. So the thought comes in, it makes them feel scared, and then it makes them do something. And OCD, it has an exact recipe, which is helpful to know with treatment. And so I always describe it like a scary movie. So if we're watching a scary movie, and I think it's Friday the 13th with Jason. So if we're watching that, I might have the wrong guy, but whatever. We're watching the scary movie, and the villain comes on the screen, Jason comes on the screen, and then we jump. It's scary. But then he goes away. If he stayed on the screen the whole time, we'd be like, this guy, he doesn't scare me. Like, okay, this might be gross, it might be gory, but he's never going away, So OCD, the thoughts and fears, the intrusive thoughts that come, have to go away and hide. And then when the person starts feeling physically uncomfortable, they come in, raise somebody's anxiety, and then they go away before the person has a chance to have their physical anxiety go down. And so OCD has a recipe that it follows.
And what's the best treatment?
So the best treatment for OCD is ERP, exposure and response prevention. And that's the gold standard of treatment. There are other treatments, acceptance and commitment therapy. If you look at other therapies, you always see an element of exposure and response prevention. It is absolutely the best therapy. And it's a specialty to do that. It's very, very different from talk therapy. So a lot of times talk therapy is not helpful to people with OCD.
What's the difference between talk therapy and ERP?
Yes, so there's a huge difference. So with talk therapy, as you know, like when a client comes in, you sit down, you talk to them, you talk about their feelings. If a client came in with a fear, say I come in and I'm like, well, I'm going to be in a podcast. I'm a little bit afraid of how I'm going to do, and you're my therapist. You would sit down and talk to me about how, well, have you talked before? Have you done a good job? What did, you say things make you feel better. Let me talk. And that would be kind of what talk therapy would look like, a simplistic kind of view of talk therapy, but that would be basically what would happen. Mm-hmm. If I had OCD and I came in and said, well, I'm going to be on a podcast and I keep having these images of knocking the microphone over and they can't go away. I keep thinking about it. And I keep looking up, has this ever happened to anybody? Has anybody ever done this before? And I'm looking it up all the time on the computer and I'm practicing and I'm taking pictures and videos of myself practicing and making sure I don't get near the microphone to knock it over. That would probably be OCD. And so if you try to talk to me about it, it would just make it worse. If you said, oh my goodness, well, do you think you might do it? What makes you think you might do it? I'd go, I don't know. Do you think I might do it? I would be more and more scared. So talking, it just feeds it, and reassurance would make me feel a little better. But if you said, I know you're not going to do that, I would probably feel a little better. But then probably in about 10 hours, approximately, I would come back. I would be texting you. I would be calling you and saying, I know you said that, but I don't know if you're right, because how do you know for sure? I need to know this 100%, because what if you haven't seen me? How do you know? There's always going to be a what if. And then you could make me feel better and say, oh, well, that'll give me all this evidence as to why I wouldn't do that and things would be better and I would feel better. And then soon after that, I would call you up again and say, well, what about this? What about that? So talk therapy and giving somebody kind of reassurance, it just feeds OCD. It feeds into the idea that there's a danger there, that this thought is dangerous and it has meaning. When it does, it has meaning in that it's horrible for the person to experience, but it doesn't have meaning in that it's not dangerous. It's not going to happen, if that makes sense.
Yes. But how do you expose clients to their fears?
Yes. So first, before I even start ERP, especially if a client has never had exposure therapy before, I really work on the relationship. I really work on explaining to them what OCD is, why this helps. Because most people come in with OCD and they feel like, get rid of this. I don't want to think about this thing. Just make it go away, which of course, but you can't make intrusive thoughts go away. As you know, when we talked about, everyone has them. So the only way to help, so I talk about that. I talk about OCD's recipe. I give them a lot of information about OCD and then about how ERP helps. And then once somebody's willing and ready and kind of sees what it is and understands, then we start ERP. I make a list with them of all kinds of things that we can do. So for example, with the stove, if someone is fearful that they're going to leave their stove on and it's going to burn their house down, and so they're checking it, I make a list with them about, okay, well, what if you went out, didn't check the stove, walked outside your house and stood outside your door and set a phone alarm on your phone for a minute and waited and didn't go check? How much anxiety would you have? And I write it down. And they might say, I say 1 to 10. They might say 5. And I say, okay, I write it down. What if you walked out your door, went to the store and didn't check your stove and you were gone for an hour? How much anxiety would you have? An 8. What if you left your dog in the house and didn't check your stove and you went to the store for an hour? A 10. So, okay, what if you read a story about not checking your stove and your house, and in the story we said your house burned down? How much anxiety do you have? They might say a 4. And so then I pick with them which one causes you the least amount of anxiety, and then they do that exercise every day. So say you said, okay, the story, I could do that. I don't like it, but I can do it. I can read that story every day. So they read that story every day until the story gets boring. And at first, it's really hard for people with OCD to feel like that could happen. It's really hard to imagine that these things that are so scary can actually become boring and not scary to you.
Right.
So I have them read it every day until it pretty much is no longer causing them anxiety. And then we work our way up the list until those situations are not
You get
causing.
to the 10s.
Exactly. Yeah. So then that way, if an intrusive thought comes in, they're experiencing it differently. And they've had a chance to mess up the OCD recipe. They've had a chance to sit with something that scares them. And it doesn't go, feel their anxiety go up and then feel it go down while it's still there, because OCD will go away and hide. So they're having, basically they're sitting with it.
To sit with your emotions.
Yes.
With and until you lose that association, right?
Correct. Yeah.
And
it's desensitizing.
Can medication help?
So for some people, medication can help. I feel like medication is very personal. So people will ask me about it. For some people, it's helpful. The thing about medication, a lot of antidepressants that are used to reduce anxiety can help people feel less physically panicked, and that can help them work on exposure exercises better. Some people don't want to do that. I've seen people who have really severe anxiety, really severe OCD, decide they don't want to use medication. And some of those people have done very well with ERP. So it's not that you have to do it. You can do it. For some people, it's very helpful in reducing their physical anxiety. So it's just kind of a personal choice. And you never know with medication. A lot of people benefit from medication, but some people do have side effects or don't. So it's kind of a personal choice.
Yes. How do you see people with people with OCD? How does it interfere, like their work or their relationships?
Yeah. So OCD really, really does interfere with many areas of someone's life, especially when it's gone on. Sometimes in the beginning, it starts off slow. And it can really kind of trick you into doing things. And you feel like, well, if I'm, the stove example is easy, so I'll use that. Like if I'm just checking it once before I leave, or it's 5 minutes of my time, what's the difference? And I wish it would stay like that, because then it wouldn't matter. But usually with OCD, always pretty much with OCD, if it is OCD, it keeps growing. And somebody will be experiencing, oh, now I have to do it more. Now I have to take pictures of the stove. Now I have to take a video of myself checking the stove. Now I have to text my partner to say, are you sure that I'm doing this right? So there's more and more steps with time. And so that starts interfering with somebody's life. Sometimes I've seen many people who get it to a place where they can't go to work. They can't go out. Their relationships are taken over by talk about, am I safe? Is this safe? Do you think this bad thing's going to happen? So that really, really impairs a lot of someone's life, and it can get more and more so if it's not treated. If it's treated, it's very, very treatable.
Okay. And how does it show up differently in like adolescents versus adults or children?
Yeah. So OCD, it can be a little bit different for children, adolescents, and adults. It really is unique for each individual. So that's why there's no, there are kind of, if you look types up, it can be helpful, but there's no specific type of OCD. And so for each person, it's kind of individualized. But for adolescents, a common theme, because I think of puberty happening, there's a lot of sexual themed OCD for adolescents. Not all adolescents. Adolescents can have any theme of OCD, but sexual themed OCD is very common. Sometimes at that age, kids can have themes about their sexuality, about just like violent sexual images. And it makes sense because their body is going through changes and they're starting to have sexual feelings. And at the same time, they have OCD that's causing these things to make them feel scared. And for kids, there might be a little more magical kind of thinking, but OCD, even in adults, gets them to kind of think in a magical way of like, if I do this thing, I'm safe, So it's not always, it's not logical.
Right.
If that makes sense.
Yes. And what advice would you give to someone who thinks that they might have OCD?
So I would say if someone thinks they might have OCD, I would the best advice, if they're able to, would be to seek a therapist who specializes in OCD. And the easiest way to find out if a therapist specializes in OCD is if they do exposure and response prevention. So I know sometimes on therapy sites, therapists will say, when you sign up for a therapy site, there's a huge checklist, and do you treat depression? Do you treat ADHD?
Everything.
Yes. Oh, OCD, that's anxiety. I treat, but really OCD is very different. And so a therapist might be listed as treating OCD, but you really want to see, do they do exposure and response prevention? Because that would be a key in, do they really treat OCD? And then I would say you could meet with that person and get a diagnosis. They can talk with you and then go from there to decide what you want to do. I mean, there are also support groups out there that you can, online, there are groups to help with therapy, with exposure, if you can't afford ongoing therapy, but sitting with a therapist is the best way.
Okay. And how can loved ones support someone with OCD without enabling the compulsions?
Yes, that is a huge deal because OCD is so hard. This logic, things that would normal problem solving, that would fix a problem, that would fix somebody's anxiety, it makes OCD worse.
Right.
So telling someone, you're going to be okay, it's going to be okay, that normally is something natural that you would do for your kids and normally, or your partner, and normally that would help and make them feel better. But with OCD, it feeds it. It does make them feel better temporarily, but then they need more and more and more. So it's really hard. Parents will have their kids texting them throughout the day. Are you sure this is going to be okay? Are you sure there's no germs? Are you sure? Whatever their fear is, texting them about that. And it's hard for parents. You're in this dilemma of, well, can I say, yes, you're going to be okay so we can just get to school? Or am I going to say, well, I think this is just OCD and have my kid have a complete panic attack and meltdown. So sometimes I feel like OCD therapists can be a little harsh on this, especially with parents, because they're like, nope, tell them it's OCD. And, I agree to a point, but if you've gone from full reassurance all the time because you didn't know your child had OCD, they've gotten used to that. There's so many routines in the house that get so like, for example, with germ OCD. You could be cleaning everything all the time because your kid needs that, you think, and you feel like that's the only way to get anything done, because if I don't do that, they have a panic attack and a meltdown. But that list gets longer and longer and longer of stuff you have to do. And then you realize that it's OCD and you go to a therapist. It's very hard to just stop doing all that stuff at one time. So I really like to educate family members along with the person who has OCD so they know what OCD is. And they can say something to them like, I think your OCD might be tricking you. Because I feel like it's a little more, or even talk with them about, okay, well, when you have OCD, what should we say? We can't, we can no longer say, you're going to be okay, or these things that are reassuring.
Or
this
get
therapist
angry.
is telling us this, or get angry. The therapist is telling us this is what we need to do. And you work together with your child or your partner to say, what would you like me to say? Sometimes with kids and even adults, they'll name OCD. Like, what name do you want to give it? It could be OCD, or it could be whatever name. Like some people might be like Steve, So it gives people communication. Like, Steve's bugging me again. If you're with your partner and you're like, what's up? So you could say, Steve's bugging me again.
Right.
And so it's a way to talk about it without getting reassurance and without getting into the trap.
I have a saying that I love: name it to tame it, right? You got to be able to name it.
Exactly. Perfectly. That's great for OCD.
Yes. And is there something you want to say to someone who maybe is watching and struggling with OCD?
I know it's so hard to have OCD. It really, really impacts every area of your life. And oftentimes when I see people, they are feeling very hopeless and sad and overwhelmed. But exposure therapy, it really, really does help. And so there is treatment out there that does help. It's a matter of finding a therapist you're comfortable with and getting the right kind of therapy.
Okay, well, thank you so much, Amy, for all this information and so much knowledge. Is there something else you want to share?
Well, I don't know. Do you have any other questions for me? I feel like I answered a lot of questions. I'm trying to think of something else I could share.
Well, yeah. Where can they find you if they want to learn more about you?
Okay. So I'm in Yorba Linda and I'm online. It's Amy Herter, LMFT. And I do therapy in person in Yorba Linda, or I do telehealth. And I see children, families, any age, adults.
Dealing with OCD.
Yes,
right?
dealing with OCD primarily, or OCD-related disorders.
Okay.
Yes.
Well, thank you so much for joining us. It was a pleasure having you, and I hope you come back.
Thank you so much. Thank you for having me.
And thank you for being with us, and we hope to see you again soon.